Mulvinaka, and welcome to another episode of Oceania Hospital's Health Talk. I'm your host, Priscilla. And before we begin, message Nakabakalev to all our viewers out there. Thank you for continuing to follow our social media pages, especially on YouTube. Thank you for the likes, views, and subscriptions. So today, our guest is Dr. Sekaia one of the many general practitioners here at the hospital. He'll also be helping us unpack on the topic of general health. Before we kickstart the show, I'd like to introduce Dr. Sekai, and I request if you can just give us a few details about himself.
Thank you, Sila. Bulwinaka, I'm Sekaia Nimatewal. I'm from Nayaulau, Vasu Nriketi Wanolevu. I graduated from the Fiji School of Medicine in 2017. I did internship at CWM in 2018. After that, I was posted in Matuku Health Center for at least a year. When I came back in 2020, that was just when COVID was beginning. I joined the COVID response team for the 3 waves of COVID, and I was mainly based at Suva Health, but I've relieved from Lami Health Center all the way to Makwe Health Center, and I've also done a few months at the Diabetic Hub before joining Oceania.
So we'll just go straight into the first question. So currently we're seeing more cases of lifestyle-related illnesses like diabetes and high blood pressure. From your experience, what are the biggest contributors to this trend, and how can families take simple steps to prevent it?
Thank you. I would say 2 of the main contributors from my experience is sedentary lifestyle and also an unhealthy diet. So we come to work, we sit at a desk, and then we go home, drive home, and then watch TV or whatever. And then the amount of food we're taking in doesn't match the activity level we're putting in. So all these sugars and fats build up, and these lead to non-communicable diseases such as high blood pressure and diabetes, which leads to heart disease, stroke. And so simple steps that we can take is just lifestyle changes, making sure that the amount of food we take in matches the activity level we're putting in. So if our life sort of has a lot of sedentary activities, probably put in more exercise, or maybe portioning food and taking less.
Naka, I think many of us are guilty of that, considering the fact that we love our food. But anyways, speaking of food, so traditional foods in Fiji are often very healthy, but modern processed foods are becoming more common. What advice would you give people about making better food choices while still enjoying our local diet?
I think in our day we love our processed foods, the snacks and fast foods. I guess as a general practitioner, some advice I would give for our audience is probably cooking more rather than buying fast food, because when you cook, you're able to make choices yourself. You know what's going into your food. Another simple thing I would probably advise is growing a garden. You can grow your own vegetables, and you use that in your cooking, and that also serves as a activity, an exercise, and and food tastes better when you know it. You're growing it yourself. And also the other thing I mentioned was probably portioning. We have this thing known as the healthy plate. So half of the plate is like vegetables, 1/6 is bodybuilding, and the other 2/6 is carbohydrates. And so, with the Pacific Islanders, we love to eat and we love to finish the plate.
Over healthy plate.
Yeah. So it's just portioning, knowing, just having self-control and knowing when not to eat too much. And not serving a huge amount, just,
I think that's going to be tough for a bit of us to specific. So exercise can sometimes feel like something you need a gym for. But here in Fiji, we have so many opportunities to be active outdoors. What are some easy, culturally relevant ways people can stay active every day? I think you mentioned gardening earlier. Any other tips that you have for our viewers?
Yeah, so when I go for screening outreaches and I meet patients who have large body mass indexes, I always advise them to set realistic goals, not to try and tackle it overnight, because when you set unrealistic goals, there's always high chances of failure and high chances of relapsing. So I always advise them. So yeah, gardening is one. Another thing is like, taking the stairs instead of using the elevator, instead of catching a cab or bus, walking. In the afternoons, you always see people playing sports at Albert Park or walking around the seawall. These are all like realistic ways of keeping active. Um, yeah, that's probably how I
Okay, many Fijians don't always go for regular checkups. I think that's a common occurrence, but until they feel unwell. So, why is preventative care so important, and what are the basic health screenings would you recommend for our local communities?
Yeah, so this is an important question because NCDs, unlike other diseases, you don't know you have it until it's too late. So that's why it's good to be proactive and have screening done even when you feel well, because you won't know until you come in with an infected leg and the doctor advises, oh, we'll have to cut off your leg, which is already too late. It's really hard to reverse disease when it's at the late stages. So these diseases, you need to be very proactive, come in for regular screening so you can know what your sugar level is, what your blood pressure level is. So you can come in every like regular checkups. Come into Oceania and get your blood pressure taken. It's simple, just come get your vitals done, and you can have your blood test done every 3 to 6 months so you can know your cholesterol levels and your kidney levels so you know whether you're healthy or you have risk factors that are contributing to you developing these NCDs and taking the necessary steps to prevent you from developing the later stages, which is very hard to reverse, and those stages can lead to even death. Yeah.
Thank you. So, finally, if you could leave our listeners across Fiji and the Pacific with one key message about taking charge of their health, what would it be?
I guess there's like a common thread through everything that I'm saying. I guess I just use a cliched saying health is wealth, because the truth is you are in charge of your own health, and the decisions you make, it will result in your future. So if you make conscious choices to make healthy decisions today, it will affect your future and the future generations.
Blaka. So that brings us to the end of our podcast today. Once again, thank you for availing your time and helping us unpack the topic of general health, and also giving advice to our viewers on how to live a better lifestyle, especially in this day and age where we are always rushing around, always in terms of fast food and whatnot. So you heard it from us here today. Live a healthy lifestyle, and as Dr. Sekaia said, health is wealth. Until next time, this has been Oceania Hospital's Health Talk. I'm your host, Priscilla, and once again, thank you to our guest, Dr. Sekaia. Naka.